Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and today I'd like to share with you Rockstar Hygienist trait number 8. Rockstar hygienists help fill their doctor's schedule. So, doctor, I know you would love to see more restorative enrollment coming out of hygiene, and any doctor I've ever met feels the same way. But sometimes it's just not happening. And maybe it is a function of your hygienist not having enough time in their schedule, and we're going to talk about that in a coming video. But maybe it's because you have missed a critical step in training and setting up your expectations for co-diagnosis. So, working with thousands of hygienists over the years in live seminars and coaching, I have come to find out that there are two very common reasons why hygienists are timid in this area. One is the "I'm not supposed to diagnose" syndrome, and two is that they just don't have a deep enough knowledge of your treatment philosophy. So, here are 3 simple steps to help them overcome these obstacles and increase the level of co-diagnosis. So step 1 is to empower your hygienist by clearly stating to them that you have confidence in their dental knowledge and their skills, and that you have set out really clear expectations. So if you expect them to take 1 photo on every patient with outstanding treatment, then get it in writing. Make it a clear written expectation for everybody on the team. And if your hygienist has taken the patient down the road towards restorative, please, unless they are way off base with what they've recommended, try not to undo what they have teed up for you. This really, it really hurts their confidence. And the more this occurs, the less frequently they will take the patient down that road, because it just diminishes all the confidence that they've built. So that brings us to step number 2. Give your hygienist permission to observe restorative needs and begin to educate their patients on these conditions. This includes permission to participate in the diagnosis and taking the patient as far down the diagnostic path as possible. Now, let me be clear. The doctor is the one that's going to make the final diagnosis and the final treatment plan, but it is well within the realm of the hygienist's responsibility to pre-diagnose and create a preliminary treatment plan, so that when doctor comes in, all you have to do is nod your head or make a couple tweaks, and it makes that doctor exam so much more efficient and easy. Step number 3, and this is the most critical of all, is clearly communicating your treatment philosophy to your entire team. So dentists often assume that just because their team has worked with them for a while, that they understand what their treatment philosophy is. And while that may be true with some team members, it may not be true with everyone. And if you have multiple hygienists, it is especially important to be sure that everybody is on the same page. So one of the ways I recommend you do this is to block off an hour a month, at least for the first 3 or 4 months, and bring a couple cases to the table and have everybody on your team create a treatment plan, and then compare that to what you recommended. And this is a very safe environment of learning, so we can ask questions, we can raise doubts, we can raise concerns, all in the quest to really get aligned and calibrated and get your hygienist completely on board and confident in your treatment philosophy, so then they can strongly communicate that to your patients. Now, here's a hint. Doctors, as you're working in operative, take photos after you remove those crusty old amalgams, so that your team, especially your hygienist and your admin team, can see what it looks like under there. Show them what the decay looks like under those old restorations, because they never get to see that. And that really builds their confidence in your treatment and gives them that strong conviction as to what's going on under these old restorations and why the patient must move forward. So if you implement these 3 steps, you're going to increase your hygienist's confidence in co-diagnosis, increase the amount of restorative that's enrolled, and just help get your patients that much healthier. Thank you. If you enjoyed this, I encourage you to go to our website, InspiredHygiene.com, request our free CD, and join our weekly easing reader group.